Hope your work week is off to a good start. You're watching Monday's edition of COVID-19. Korea's daily tally has dropped to below 500 in light of the weekend factor. Meanwhile, vaccine inequality continues as India faces a nightmare while other countries prepare for a return to some form of normality. We have details later on. Here first is the broader pandemic coverage with our Kwon So-ah. So let's start here in Korea then.
All right, Sunny. The first Monday of May has kicked off with less than 500 infections of the coronavirus here in Korea, 488 to be exact as of 12 a.m., with domestic transmissions standing at 465 and imported cases at 23. And with that, the total number of accumulated cases stands at 123,728, and the death toll is at 1,834. And if we take a look at the region, still infections are scattered across the country with a similar daily increase in the capital Seoul and Gyeonggi-do province at around 130. And then here we've got also more than 40 cases in Gyeongsangnam-do province, and Ulsan now having surpassed 2,000 cases in total. The concern over there is due to UK variants making up a big proportion of infections recently there. And let's take a look at our graph now. We've got a mix of the high 400s and high 700s in the past week. Let's also compare the Monday figure, as Mondays usually the number is a little lower than on other days due to fewer tests conducted over the weekend. So we see we've had a rise here for the past weeks, but a slight decline from last Monday. And the average in domestic cases in the past week now stands below 600.
Right, and so I believe seasonal factors are looking to aggravate the current COVID-19 situation here in the country.
Exactly, Sunny, which is why social distancing measures have also been extended for 3 more weeks beginning today. And it's not only the warming weather, but the month of May here in Korea means Children's Day, Parents' Day, Teachers' Day, as well as Buddha's birthday. So here, authorities are calling on extra vigilance.
There are risks of the virus spreading through more gatherings and interpersonal contact, with May being Family Month. We ask citizens to avoid all celebration gatherings and travel. And if you absolutely must attend, to make use of outdoor instead of indoor settings.
Let's move on to our vaccination updates. Usually on Sundays, we have fewer vaccinations administered in the country. But on Saturday, there's been the highest number of daily vaccinations, which has now raised the total number of people who received at least one shot at almost 3.4 million. And in the meantime, later this Monday, the government is also going to hold a briefing on the vaccination supply in the second quarter. Also, an urgent approval has been made by the World Health Organization for Moderna's vaccine. So that's the 5th product to be given the green light by the organization. But despite millions of vaccinations being administered as we speak, still the cases numbers of coronavirus are still emerging at worrying speeds, recently having hit over 900,000 in just a day. Now, as of noon Korea time, over 680,000 cases have been reported, raising the total to above 153.4 million. And currently, the worst situation is unfolding in India, which is making up around 40% of those cases, with a record high of over 400,000 daily infections reported on Saturday. Tons of oxygen supply is lacking. Hospitals have been running out of these since around 2 weeks. Graveyards are packed with thousands dying every day. More and more countries are restricting travel with India while sending aid in forms of medical supply and vaccines. And let's also take a look at the numbers here in India. 19.9 million, so close to 20 million now, followed by Brazil and France, and the U.S. having surpassed 33.1 million. Meanwhile, here Argentina has hit the 3 million mark in the past day. And those are the updates I have for now. Back to you, Sunny.
All right, so thank you for that. Right, back on the local front, Korea has administered the first dose of the COVID-19 vaccine to 6% of its population. Now, with the inoculation campaign picking up pace, many are reaching out to vaccination call centers with various questions. To take a look.
A special hotline to handle vaccine-related inquiries was launched in mid-April by the Yangcheon-gu District Office in Seoul. Currently, there are 4 main channels available to citizens for vaccine-related inquiries. The KDCA and the Ministry of Food and Drug Safety call centers provide general information, while regional vaccination centers have hotlines available for the booking of vaccine appointments as well as the reporting of adverse reactions.
저희가 접종 종료할 때까지 같이 동일하게 운영할 예정이고요. 돌봄 SOS 매니저 간호직 공무원으로 구성이 되어 있고요. 평균적으로 일반 상담 같은 경우에는 한 250에서 300건 정도의 전화 문의가 오고 있고요. 이상 반응에 대한 상담이나 아니면 진료 안내, 이런 진료를 받아야 되나요? 이런 정도의 문의는 한 50건 정도 1일 평균으로 들어오고 있습니다.
Call centers are a high-risk environment for droplet transmissions, requiring face masks and partitions for the workers. One of the most frequently asked questions on this hotline is people seeking advice on what to do when they experience fevers post-inoculation.
네, 어르신 무슨 일로 전화 주셨을까요? 네, 지금 좀 열이 난다는 말씀이신 거죠?
So what's the general advice on the use of fever medication after getting your vaccine?
징후가 느껴지는 그 순간 바로 해열 진통제를 드시는 게 좋고요. 그런 해열 진통제의 그 효과가 보통 한 6시간에서 8시간 정도 갑니다. 하루에 한 3-4번 정도까지 계속 드시는 게 이제 도움이 될 거고요. 한 2-3일 정도까지는 이렇게 이제 해열 진통제를 드시면서 좀 이렇게 이제 상황을 보셔도 될 것 같습니다. 3일이 지났는데도 열이 계속 39도 이상 나고 전신의 그런 증상들이 심하다라고 했을 때는 그거는 병원을 좀 방문하셔서 진료를 보셔야 될 것 같습니다.
There have also been many reports of people experiencing indigestion after receiving their vaccine.
어떤 분들은 소화기 증상도 나타나거든요. 오심, 구토, 설사 이런 증상들이 그 특별한 요인이 있다 이런 게 아니라 병원체 이런 거에서 생긴 게 아니라 투여된 소량의 백신에 의한 면역 반응이기 때문에 대부분은 이제 수일 내에 호전이 되거든요.
접종 당일에 컨디션 악화라든지 입원 치료 이런 사유면은 본인이 원하는 날짜에 저희가 변경을 해드리고 있고, 예약 취소 같은 경우에는 이제 불가피한 사유일 경우에 저희가 본인한테 어느 정도 후순위로 밀려날 수 있다라는 거를 좀 인지를 시켜드리고 본인 동의하에 예약 취소를 진행하고 있습니다.
The center also fields inquiries on vaccines that have been left idle, like people not showing up for their vaccine appointments.
그런 경우에는 이 인근에 있는 예비 대기자 명단에서 전화드려서 빨리 오셔가지고 맞게끔 그렇게 조치를 취하고 있습니다.
So as long as vaccines continue to roll out, so too will the inquiries. And there will always be somebody at this call center to answer all your questions until the day we reach herd immunity.
I made sure we have 600 million doses of the mRNA, not of either Johnson & Johnson and or AstraZeneca.
तो लेने आए हॉस्पिटल से सिलेंडर उठा के हम लेने आए कहते एक जगह और वहाँ नहीं भरा रहा है फिर वहाँ लेके आए प्लीज भरवा दीजिए जल्दी मेरा
It's been a year well into the pandemic, and we appear to be looking at two contrasting realities. On the one hand, we have countries looking to return to a new normal, while on the other hand, we have countries fighting a fresh nightmare of COVID-19. For more, I have Professor Kim Moon-gyu from Yonsei University. Welcome back, Professor Kim.
Good afternoon.
And I also have Dr. David Kwak from Soonchunhyang University Hospital. Good to see you again, Dr. Kwak.
Thanks for having me.
Professor Kim, let's begin then with a few words on the COVID-19 situation here on the local front.
Yeah, the numbers is about 60s, and it's not increasing, not decreasing. I mean, it's going the same phase. If it shows a consistent increase or decrease, I think that would be a significant finding. But I think it's going to take some time to see a significant drop. Anyway, the mortality is low. It's maintained in one-digit numbers, and if we compare with the confirmed cases of Korea 1 or 2 weeks before, I think the vaccine is working. So if we follow the steps of the other Western countries who are succeeding in vaccination, I think Korea might follow the same thing. So we might have to wait a little bit more time to find a decrease in the confirmed cases.
Right. Meanwhile, Dr. Kwak, as Soa mentioned earlier on, over in Ulsan, officials there are seeking to contain the UK variant of the coronavirus. Now, if these efforts fail, do you see the UK variant there as emerging as the dominant strain?
I don't think it would be the failure of our trial to contain the spread there, really, that the virus will inevitably become eventually dominant in the country. If we look at cases in South Africa or Brazil, for example, it took only a couple months or even shorter for their country or the variant there to actually take dominance over, if I'm not incorrect, over 80% of the whole population. So it will eventually take dominance here as well, I believe, but the fact that we have to pay also attention to is the fact that in the United States, where all these new variants from different countries also exist, probably in many more cases, they found that the intrusion, the variants made in the people who are already immune, either through vaccination or through prior infection, is very, very low. Again, I might be incorrect on the exact numbers, but if my memory recalls it correctly, it's less than 0.01% that the people who are already immune were infected with the new variant. So once again, the importance of vaccination in our population is that much more important at this stage, because the further that we get immune towards any variants, let's say, the further protected we will be even against the new variants. But again, going back to the original topic of whether or not the variants will give effect in our country, I believe eventually it will do so. But if we have majority of the people immune against the virus as a whole, I think that effect, even if it is dominant, will be very little.
I see. Professor Kim, you mentioned earlier about the positive impact of our vaccinations on the death toll here in Korea. Would it be safe to link it perhaps then to the recent drop in cases that we've been having on a daily basis?
It's difficult to match directly. Always there is some gap between the reality and the numbers, and I think some months later, I expect that confirmed case will follow to drop, but it will be dependent upon the speed of our vaccine program. How fast and effectively do we vaccinate all our people? And in USA, some states are giving out some amount of money, $50 or $100 to facilitate the vaccination program. It's same for Israel, because when they reached 40% of vaccination, they made a plateau, and I think it's the same situation in the United States. And we might have the similar situation also, because a lot of talking about the complications, and there's some worry about this new vaccination. So Korean government has to make an idea to try to motivate all the people who is reluctant.
Right. And staying with vaccinations, Dr. Kwok, come mid-May, the second doses of the AstraZeneca vaccines are to be administered. I suppose the availability of vaccines now will determine the success of our second round of inoculations.
Well, absolutely. That goes without saying. We need, well, the attempt that we are trying to achieve in our population to reach the herd immunity obviously follows on the basis that we do have the stocks enough to inoculate our own people. Some of the news reports are saying that we're quite keenly running out of the stocks we currently had at hand, approximately 200,000 to 300,000 possibly left for the week. But the government is also stating that we will get more than 3 million to 6 million shots worth of dosages probably within this week or so. I do believe what government is saying, so hopefully there will be no gaps or time-wise to catch up for coming this week or the next week, hopefully. But if the process takes a stall in any sense, it will not just delay the process of inoculating people, but it can also mean a devastating result for people who's already received their first shots, because we were originally recommended to receive 2 different shots in between times of 8 to 12 weeks for AstraZeneca vaccine and 3 to 6 weeks of Pfizer vaccine. If anyone actually passes that time frame and gets, let's say, the shot even 15 or 16 weeks later, it means that there's a possibility the immunity that it creates may get weaker. That should never happen. So let's make sure that the vaccinations we're supposed to get into the country this week or next week do arrive on our soil in the time frame.
Right. Now, meanwhile, efforts to ensure vaccine equality are in the works, and observers are hoping for greater strides in the near future as India struggles to contain a resurgence that pundits believe has global implications. I now have Dr. Amitabh Arya at the Sanjay Gandhi Postgraduate Institute of Medical Sciences live on the line. Pleasure to have you with us again, Dr. Arya.
Yeah. 안녕하세요.
Dr. Arya, this past Saturday, that would be, India recorded yet another daily high with over 400,000 new infections in a span of 24 hours. What can you tell us about the COVID-19 situation over in India at the moment?
At present, it is really bad because it is something like what we have in the first wave in Spain and Italy. We are overwhelmed with patients, and we have, as per WHO, we have 3 mutations of the virus. And the double mutant virus is spreading fast, and that is the reason that we have there's a shortage of oxygen, but it has been replenished now. We have shortage of beds, but slowly we are making new beds, new ICUs. Right now the situation is really grim.
Dr. Arya, some pundits believe India's COVID-19 crisis has graver implications for global health. Do you share this view?
I think, as per the reports, it has been the double mutant variety, which came from India, has gone to 18 countries. If I'm wrong, some cases have been reported. But I think with the stoppage of the air travel by many countries and the government going overboard and making more makeshift hospitals, and with vaccination going for those who are from 18 years age, I think it won't be a big global implication, as I believe.
Dr. Arya, how are medical experts like yourself shouldering the burden of this latest resurgence in India?
Yeah, right now we are having a crisis, no doubt, but we are having new makeshift hospitals. Like the army has come in, they are making makeshift hospitals. Then we have the defense and DRDO, which is defense organization. We are having makeshift hospitals. We are turning the stadiums and we are turning the different places for having a new burden of patients. And vaccination has been allowed for those above 18 years also, which was initially above 45 years age. Vaccination is in full roll, and with the help of with the new. We have help from almost 45 to 50 countries, even from Korea. And we are having oxygen concentrators and ventilators. So there has been a big help from the world community, and somehow we are coping it, and I hope we'll overcome this.
Right, we hope so too, of course.
Yeah.
Professor Kim, it is clear that India is struggling to fend off a humanitarian crisis of significant proportions. What worries you most about this latest crisis in India?
As Dr. Arya mentioned, the double mutant B1617 is first found in India October 2020, and as other variants, it's more transmissible, and study is needed to see whether it causes more mortality or not, but there is a possibility right now. Usually the last variant takes over the previous ones, and it has a high possibility that it might spread globally, including Korea. So it's also has some escape phenomenon for some products. So the products already we have might not be effective for this strain. So it's something that India only cannot deal with. So if you look at the history, when there was a Korean War in our peninsula, India sent the medical team and ambulances to Korea to help us. So we remember that, and we should approach the problem in India right now as we did in the history.
Right, collaboration is very important,
Yep.
of course. Dr. Kwak, do you suppose unequal access to vaccines is perhaps to blame for the contrasting realities in India and perhaps in the US, with one country fighting a nightmare and another poised to make a comeback with 100 million Americans fully vaccinated?
Well, I wouldn't necessarily be able to pinpoint just on the discrepancy in the vaccinations for the differences that are happening in both India and the US. It's because also many other countries are having the same status as to securing enough vaccine dosages for their own population. It's not only India that is having trouble getting the vaccines there. Now, having said that, it's also to do with socially distancing and also socially distancing measures that the government try to put on themselves. It seems like from the reports that I've seen through the past week or so, India was having much of, let's say, political issues going on in the country and the religious issues going on in the country, that they had to be more lenient in regards to socially distancing. So I think that took a huge part in sort of provoking and helping towards spread of the virus in the country. It's sadly what's already happened, and now they have to take the control back, but it's going to take much effort and time to do so, like how we dealt with prior cluster waves of our own in the past. But vaccines, of course, take parts in this, because if enough people were to have been vaccinated in India, they would have obviously been hit with much less of the wave than what they are hit now. But what can we do about it? I guess it's the part that the countries that develop these vaccines can do. I know today we're going to have that as a topic of conversation as well, but it's a matter with patency, really. So if all these countries, including India, it's actually one of the largest countries that are able to manufacture the vaccines. If only not for the patent issue, they would be able to actually mass produce these vaccines and would be able to probably utilize them for their own purposes. Likewise, we would be able to do for ourselves. So I guess I'm hoping that maybe in the near future, these different countries that are able to manufacture these vaccines would be able to multiply their ability of manufacture and maybe start mass producing in the multiples of what they're producing now, and be able to reach all the population globally so that most everyone could be vaccinated and get immune against the virus.
And we'll get into that topic in a little bit in a while, of course. Dr. Arya, you spoke about the vaccination campaign in India being on track. What is the status of supplies of COVID-19 vaccines in India then?
We actually have a production on. Definitely, we needed more vaccines. So now we are getting, we have got clearance of the Russian vaccine, which has arrived already. And we have also approached the other company manufacturers to supply us the vaccines, along with our indigenous vaccine, which is Covaxin and Covishield. Right now, we have a few doses from Sputnik 5, which is Russian vaccine. And we also have ordered from other companies. I hope we have more vaccines from other manufacturers across the globe, and we are able to vaccinate more and more people in India.
Dr. Arya, generally speaking, the response to vaccine with the members of the public, is it quite high in India?
Actually, what happened, the people became lethargic. The government became little lethargic because we almost won the first wave. So what happened, the people started doing, going to picnic parties and not doing their social distancing. And actually last year, when was a complete lockdown by the Indian government, there was a lot of criticism by the people, by the business people, by the opposition, that complete lockdown led to a lot of loss to the economy. So this time what the government did, which was I think wrong, that they gave it to the state government for the lockdown, the rights of the lockdown to every state of India. So many government states, state of India did not do the lockdown, which led to this spread. And then we had the religious congregation, as one of our doctors told. So there we had a spread, definitely. Then we had rallies and election in 6 states. So that was actually the factor which spread so fast. And we were overwhelmed with patients. And now we are doing a level best, but now the cat is out of the box. Right. So we have to somehow control it.
Professor Kim, in contrast to countries that lack vaccines, do you suppose the US's ample supply of COVID-19 vaccines is serving to stem the spread of the virus within its borders?
Spreading the virus might be a hard question, but if we look at the mortality first, it's about 1.4 or 5% mortality right now, and compared with the confirmed cases with the mortality, US is showing far less mortality compared to their confirmed cases. And most of the Western countries who is good in vaccine program has the same phenomenon. So I believe that the vaccine has its own impact on this pandemic. And I believe that they will follow the pattern of Israel. So it's going to take 1 or 2 months more to find a decline in the total cases. So to accelerate the vaccine rate, it should be accessible in many places. And I think United States is doing their job, giving the vaccines even at the pharmacy store. And it's going to be a huge impact on control of COVID-19.
Right. Dr. Arya, what is your assessment of the rollout of COVID-19 vaccines across the globe?
I think we are fighting a pandemic which has crossed all the boundaries, entire humanity suffering. We have to collaborate. We can't say first our citizens, then their citizens. No, I mean, we have to cross that caste, creed, religion, the boundaries of different countries. And we have to help each other in every way. Like right now, India got help from all the oxygen supplies, medicines from almost 45 countries, including Korea. Similarly, when we made the vaccines, we send it to almost to 60, 70 countries. So we have to come together. We have to work together. This is a time of great crisis. We all have to come together. In spite of all the differences, we have to bury the differences. We have to come together, all the countries. I mean, that is my thought.
Right, which is why, Dr. Kwok, the White House recently spoke about considering the possibility of waiving intellectual property rights for COVID-19 vaccines. Now, what is the significance of this latest shift in stance? Because earlier they were opposed to the idea proposed by India and South Africa with regard to waiving the property rights of devices related to COVID-19.
Right, so without the waiver, at the state that we are in right now, the countries that are manufacturing, such as in Korea and India, those manufactured vaccines would automatically be shipped to the originally planned allocation of the places, meaning the US actually might end up getting all those vaccines back to their own country, or the other countries that have applied for these vaccines would get it instead of the countries that are manufacturing. But not only that, it also limits the number of manufacture, meaning only a limited number of the dosages can be produced to reach that limited population. If the patency is waived and maybe even temporarily, then and also be supplied with the material that are needed to produce these vaccines, all these countries that are currently manufacturing, as I said, could multiply and could start producing a lot more of the vaccines. And obviously that would have a huge impact on not just the countries that are producing these vaccines, but also the countries that are around them, and also other countries that did not have the chance to even apply for these would be able to get many more of the dosages. So it would mean a hugely better chance for the globe to fight against this virus. I am personally really having my fingers crossed that the White House's decision to waiver the patency would actually be enacted, and maybe even temporarily that the globe will be able to get over through the pandemic, at least for the time being. Maybe afterwards they could go back to having the patency enacted, or maybe some other alternative way that they will find to reach more than enough people in the globe to be immune against the virus. But at least for the time being, I think what White House has brought up is actually a bright idea.
Right. And against that backdrop, Professor Kim, some critics claim that the lifting of patent protection for COVID-19 vaccines could lead to safety issues. What are your thoughts on this?
Hot potato. It's a hot potato. And I'd rather raise some questions than answers. First, intellectual property rights. Are global powers respecting this intellectual property rights or not? Or are they just making copycats, and are they going to respect the companies who work hard to make these nice products? So that's one issue. Second, safety and effectiveness issue. So are countries in desperate need capable to make a safe and effective vaccines if allowed? It's not a medication taken by mouth. I mean, it's an injection. So we need a high quality control. So are they possible? Third, logistics. Okay, let's say that they allow to make a mass production, but how about the raw materials to make these vaccines? If it's not ready, even though you have all the patent issues solved, the production amount is going to be the same. So we have to check for that. And finally, business. What incentives should big pharma take from this pandemic? We have to respect that they have done a great job on this, but if they get nothing out of it, they're not going to be active and they're not going to be creative. So what is the ideal answer? I would like to say that we have to protect the intellectual property rights and make a cheap, safe, and effective vaccine for all. And the big pharmas should continue to lead to make new drug development. So many questions and
few answers.
Yeah, few answers.
Right. Dr. Arya, how would such a waiver, though, affect India's production of safe COVID-19 vaccines, do you think?
I think India already has its own indigenous vaccines. One is Covaxin, one is Covishield. I think, and we have been exporting many types of vaccines to other countries, especially in Africa and in Europe. I think we have a lot of good expertise in vaccine making for the last so many years. I think we'll be able to cope it. And right now, what I think is like Korea is making a vaccine, Russia is making vaccine, America is making vaccine. So we have to increase the production, because maybe a waiving of intellectual property rights, many people may not like it. Maybe they vote against it. So best is like we increase the productions, all the developed countries which they have the power, increase the production. supply it to their own population and also export it to the countries where they need the most. And that is my own thought about vaccine.
Right. And Dr. Kwok, what would be the impact of such a waiver perhaps on Korea's production of COVID-19 vaccines?
Well, as Dr. Kim already mentioned, there are many questions that still needs to be answered, and that still factors into Korea's manufacture of the vaccines, because one particular thing that I want to point out here is that a close peer of mine told me they were having issues with supply of resources for vaccination manufacture very recently, and that was one of the reasons why the number of production was limited. Namely, if, again, I'm not incorrect, it was the carbon backbone of the mRNA type vaccine that needed to be supplied and was running short. If those are not completely overcome, even if the patency is waived and we start being able to manufacture in much more massive numbers, we will not be, because the resources will be limited. So we have to take care of multiples of different things all at once to really bring this topic into reality. But that being said, the waiver of the patency is still the first step, because without the waiver, all these manufacturers will all be limited by law to the numbers that they're currently producing, and also to the places that they can deal with. So I guess that first step has to be still taken, but otherwise also an approach to this matter would the free market approach be the ultimate best approach? Meaning, if the government did not intervene and let the companies really decide on what manufacturers and what companies to do it and in what numbers, would that be right? I think as we've seen from really early waves of the pandemic in China, maybe, and also in other continents, for example, in some part of this, in dealing with some part of the pandemic, I think governmental or global intervention is rarely but sometimes necessary, because they do need to reach the unprotected people. They do need to reach the underprivileged countries. So in this case, I think both in regards to the waiver of the patency and also in regards to supply more resources to the manufacturers, I think a larger control has to come into place.
Right. Professor Kim, I am told that we can learn from a lesson in the past to better deal with the current COVID-19 crisis. Now, could you tell us a bit about the efforts to treat AIDS?
Yep. The medication for AIDS, HIV, was very high. It costs about $100,000 per person. But since the global organization tried to put down the price of it, it became about $100 for AIDS patients in the sub-Saharan countries, and that cost that was a huge impact for the treatment of HIV. And right now, already we put a huge amount of money to big pharmas to develop a effective COVID-19 vaccine, and there was no condition. I mean, just make a safe and effective vaccine. And somehow we succeeded. We have some new RNA vaccines and adenovirus vector vaccines. As you mentioned, we can learn from this HIV drug story and lower the price of this COVID-19 vaccines. But something different is it is an injection. It's not a medication taken by mouth. So it's more sophisticated. So I don't think it's going to be that cheap. But if we can put down the price of these vaccines, we should do our best, and we should gather around the table and make something out of it. So if the big pharmas are reluctant joining making a solution, and if COVID-19 pandemic continues more aggressively with variants causing more mortality, we're going to need new vaccines and so on. So it's like a squirrel wheel. I mean, nobody wants that. It's going to continue.
A vicious cycle.
Yeah, vicious cycle. So we should end this rota before it's too late.
Right, of course. Dr. Arya, countries, as you mentioned, have been rushing to aid India in fighting this latest resurgence. What further support is necessary at this moment?
I think right now the problem is we have a shortage of remdesivir injections, which is antiviral drug. We have deficiency of ventilators, oxygen cylinders, oxygen concentrators primarily. And I think that is what is being supplied by the international community, which has been a big help to India. And that is what we need right now, oxygen concentrators and oxygen supplies and medication, primarily antivirals. Yeah.
Right. Dr. Kwak, a number of countries are choosing to restrict entry to those flying in from India amid variant concerns, of course. But Korea, for its part, is seeking to focus more on boosting its health surveillance of overseas arrivals. What are your thoughts on this?
Their approaches have worked so far. I believe they've also designated a couple of countries from which the travelers come from. They were to be isolated and only strictly in social facilities instead of their privately chosen homes or quarantine facilities. So regarding the staying of these social distancing and whatnot, I think the government is measuring themselves of the righteous path. And I think their choice at this moment is probably the best that they could have come up with. I don't think restricting other countries, as we have done already before, we did not block people coming in from, let's say, China before, and it still worked. Also, in regards to other countries that we're currently dealing with, it's currently being managed. So I think the choice that the government has made for this one as well would work, and fingers crossed, of course. But in the future, if we be more careful, I guess they could maybe play with the length of their socially distancing. Maybe they could lengthen the quarantine time and mandate them to be tested multiple sometimes before they're let out of the facilities. In that way, they would be safe not only for our own people, but also for the people that are arriving from foreign countries. So different nuances that they could probably make towards the choices they made. But the biggest choice that they have made so far, I think that has currently worked.
Right, because at the moment, prevention is better than cure then. All right, Dr. Kwak, thank you very much for your thoughts. And Professor Kim, thank you for your insights today. And Dr. Arya over in India, thank you very much for your thought and your time.
Kamsahamnida.
Right, now India's COVID-19 crisis is not a national plight. It looks to become a global fight if prolonged and if unaided by the international community right now. Thank you for watching.